I'm Greg Simon. I'm an investigator at the Group Health Research Institute in Seattle. Here at the American Psychiatric Association meeting, I'm talking about this idea of a learning mental health care system. We've been doing some work on that throughout the Mental Health Research Network, which is a network of large healthcare systems and mental health researchers across the United States. We've been working specifically on using healthcare system data to help us understand risk of suicidal behavior. And we've been finding some interesting things. What we found is, as these large healthcare systems are routinely assessing outcomes of depression care using the PHQ questionnaire, that item 9 of the PHQ is a very powerful predictor of subsequent risk of suicide attempt and suicide death. And we've been able to dig into particular subgroups of patients to understand how that helps us to predict risk of suicidal behavior by age, across different racial and ethnic groups, across different care settings. The most important message we're finding, I think, is that people who report frequent thoughts of death or self-harm are at high risk of suicide attempt or suicide death over the next year. That's an enduring risk, and we need to start thinking about treating suicidal ideation not just as a short-term crisis, but an enduring vulnerability. What we're also finding, and this is something we're going to have to do a lot more work on, is that we're able to understand who is at risk of suicidal behavior, but we really are a long way from understanding when people are at risk. In that way, suicide may not be that much different from cardiovascular disease. We need to think about long-term risk because we can't really predict exactly when cardiovascular events or suicide attempts are going to happen to any individual.